Welcome to Street Level Startups. I'm your host, Katie O'Block, and this season we take an in-depth look at Colorado's inspiring startup scene. In this episode, we'll meet 3 innovative startups in Colorado that are using technology to enhance lives across the world. From early breast cancer detection to building community through adventure. First up, producer Emily Swank visits Parcel, a startup changing the way medicine is being distributed to countries in need.
What's interesting is that most of the stuff we consume today is produced elsewhere and is shipped to us, and 90% of it is containerized. We know shockingly little about the conditions under which it's transported. Sometimes that doesn't matter if you've got a container load of t-shirts, who cares? But if you've got a container full of life-saving medicine, food that we're going to consume, it matters a lot. We're trying to understand what are the quality conditions in global supply chains, and how can we give people better insight so that they can understand those risks and avoid them in the future. So we are very lucky to be partnered with Gavi, which is the Global Alliance for Vaccines and Immunization. It's a large public-private partnership. So Gavi has made these vaccines available at a lower price and more accessible, but the challenge remains getting the vaccines to kids, and that's a supply chain challenge. And most of these vaccines are cold chain, meaning they need to be kept between 2 degrees and 8 degrees Celsius. And that's really hard when you're talking about moving a vaccine from a manufacturer on one part of the world to a child in a rural health facility in another part of the world. And what we're trying to do is be able to understand, what was that vaccine exposed to on its way from the manufacturer to the child, and then give healthcare workers the actionable insights they need to be able to decide whether that vaccine is worthy of giving to the child or needs to be discarded.
Some of the mortality gains that we've had in the last several decades, a lot of it has been tied to vaccine preventable illnesses and how we've made progress in those areas. And for me, working in the United States in particular, I've always taken it for granted that when I have a medication or a vaccine that a patient needs, it's going to be safe and effective. The more I've looked at this problem, both from a humanitarian lens and also just a scientific lens, you start to see that there are gaps in what we're doing, and there's a lot of room for innovation.
We have these conversations with folks in the global health community. We have vaccinated 100% of people in this area for measles, and then there's a measles outbreak. And the hypothesis is the vaccines you gave them actually were not potent anymore. And so the big push to get vaccines to all of these places throughout the world was sort of the last 10 years. And now the push is we're getting them there, but let's make sure we're getting them there in a quality fashion.
So we use a combination of sensing devices and intelligent software to give people insights into what happened to the product, both from a backward-looking standpoint, so what happened to it, when did it happen, where did it happen, who's responsible. But we're also looking for trends and patterns in that data over time, so we can help pinpoint where risks are likely to occur and help you avoid them happening in the future.
Growing up, I didn't have the opportunity to have vaccines. I had measles when I was growing up, and I lost the younger sister of mine to measles. Making sure that people are receiving vaccines that can protect them, it's something that I think that I wanted to do. I want to make sure that every single kid in the world is having access to a potent vaccine. I want to help countries also prevent loss of vaccines, because when you look at the cost of developing a vaccine, buying it, transporting it under very stringent conditions, storing it in the cold rooms, and then to realize that at the end, these vaccines are wasted or not potent is not something that we can afford. Especially we have the technology that can do it, let's do it.
I had the opportunity to travel to Senegal last summer when we started the project there. We traveled sort of through the health system to the regional level, the district, and the health facility, which was really informative just to see how the vaccines would be traveling. Kind of we created that journey. For me, because I've always worked on the front lines, I'm most comfortable in remote, distant clinics, and so I really liked being at the health facility level and interacting with the main person there. She's in charge of all the cold chain equipment, but she also is the only medical personnel. She's a nurse midwife, so she does everything from vaccinations to delivering babies. She's doing the job I did, plus 10 others. To think that maybe we could help make her job a little easier, give her a little sense of ownership and empowerment over her vaccines. In particular, we can't help with everything else, but hopefully that, maybe we'd make it easier that she doesn't have to open the fridge every time she wants to check the temperature of her vaccines, or if she could get some sort of feedback on her mobile app to tell her that everything was fine and she didn't have to worry about that. I just liked that idea of knowing that her life would be a little bit easier by what we were doing.
So what I love about Parcel is I can really draw a direct line between the work that I do every day and the impact that we're having. It's easy to say that you're making a difference in the world, but when you come into work and you see the direct impact of the product that you're using on vaccines, on safety of products that people are consuming, it makes it really fun to come into work. And it's not several levels of indirection of, I might be making a difference if these things happen and someone uses my product in this specific way to make their own product. At Parcel, we come to work and we say, this freezer, it went bad, and these vaccines would have also gone bad if not for our product. And that's pretty inspiring.
I worked in the Obama administration at the U.S. Agency for International Development. There was this expression used throughout my career, which was ship and pray. And what that meant was we had a really hard time of understanding the quality of the goods by the time they got to their destination. When I left the administration, I just sort of found this unacceptable. In a world of the Internet of Things and cloud computing, how are we leaving something so important to chance? And that's really what inspired us to develop a product and a company that was really geared towards answering these really hard questions around what's happening to these sensitive products that are going to hard-to-reach populations and have real life-saving implications when they're delivered.
It's so important to constantly challenge the status quo by thinking big to shape a better world. You never know, your idea could be the next breakthrough in medicine and humanitarian services. Next up, we have Norma, a company whose goal is to make it easier for women to test themselves for breast cancer using just their mobile devices. Let's see how it works.
At Norma, we are building tools to help empower women to take charge of their breast health. The main way that we're doing this is with an app that provides a reminder every month to do a breast health exam, and then has a tool so that if you find something, it helps you to track exactly what you found. Then if you do have to make an appointment with your doctor to get it checked out, you have more information to provide them and also a better understanding of what your normal is so that you can detect any abnormalities sooner.
So I think traditional methods for tracking and recording breast health has been through pen and paper. Those are great, but I think they can also be easily overlooked when you're just kind of passing them. We all have our cell phones nearby, and if we can use Norma and customize it to a woman's schedule to remind her at a time and place that makes the most sense for her to do a breast health exam, we believe that she will, take that action for herself.
Norma came about at Startup Weekend. I found out about Women's Startup Weekend right before it happened, and I had just finished a certificate in UX design to supplement my degree in graphic design. I needed experience for my portfolio, and I was hoping to maybe make a couple connections. I had no idea that I'd be part of a startup, and I certainly had no idea I'd be working on this a year later.
So we came together at Startup Weekend event. One of the ideas that was pitched had to do with breast health, which really interested me because my grandmother passed away from breast cancer, my aunt had breast cancer, and I was really excited about this idea, as I think the rest of our team was. So we came together pretty quickly and started to work generating a whole bunch of ideas around how to help track changes in the breast. We kind of were basing it off of a lot of apps that are focused around period and fertility tracking, and knew that that was something that a lot of women were already comfortable doing. But once we did research, we found out that there wasn't an analogous app for breast health, and so we felt that there was really a need there that fit in with habits around tracking, but specifically focused on breast health.
My grandmother had breast cancer and she had a mastectomy, so I remember being a young girl at her house, seeing her put a gel insert into her bra because she didn't get reconstruction. When I was a freshman in college, my mom was actually diagnosed with breast cancer, so it hit home once again. It's just something that I've always paid attention to. What I didn't realize and what was most eye-opening to me back at Techstars Startup Weekend, where the idea kind of came about, was how many women didn't know what to do or didn't know the types of questions they should be asking their doctor, weren't paying attention. And that in of itself was just surprising to me. And I think more women need to pay attention and have tools and resources to know what to look for.
As we've been working on Norma, I've also gotten to know more women who are really young that are affected by breast cancer, which also includes a really good friend of mine who was 27 when she was diagnosed with breast cancer. She had actually found a lump and they hadn't conducted any further testing because she was at such a low risk of it being breast cancer. Unfortunately it was, and she was able to really push and get the testing that kind of confirmed that, and then had to go through the horribly painful process of being treated for breast cancer. I wouldn't wish that on anyone, and so I think part of my goal is to build tools that could help other people like her to earlier at least tell their doctor, no, this is what I found, and I know that it's changing and it's growing, and kind of I demand to be heard in a way.
If you are not in the medical field doing this day in, day out, it's confusing. Even if you're highly educated and feel confident asking questions, it's still very confusing, and you're going to get a different answer from a different doctor no matter what question you have. And through it all, I think it's been really helpful for us to understand that and then build Norma so that it gives women information and they can make the best decisions for themselves. There have been so many women that have been open and reached out to us to tell their stories, to really kind of share their own lessons learned that being diagnosed with breast cancer and things that they wish they had known before that diagnosis. So we've really just been out on the street talking to all different types of women who've had all different types of experiences. That's kind of informed the type of product that we wanted to build with Norma.
We have talked to so many wonderful women, survivors especially, that are really inspiring us. We feel like this is a tool that is needed. It really just keeps us going, and we are excited to see how women will use it, what features they want in the future, and just how we can make it better for them.
No one's going to take care of myself better than me, and I need to be my own advocate, and I need to come into appointments and conversations with doctors prepared with information and questions. And if I'm not satisfied with the answers I'm getting, then I owe it to myself to go find someone else who can better articulate answers to my questions or can give me a different perspective. So I think that's the biggest thing that I personally learned, is that I have to be my own advocate. And I would hope that other women feel the same and feel that type of urgency too, that trust your doctor, but also trust in yourself.
Taking charge of your own health can be an empowering experience right from your own phone. Next up, Street Level producer Emily Swank takes a closer look at a company that is encouraging women to step outside of their comfort zones. Ironically, they use technology to get women away from the screens and into the outdoors. Bold Betties organizes amazing outdoor adventures with local women in efforts to gain self-fulfillment and empowerment. From whitewater rafting to mountain climbing, you can discover your bold.
We're a national adventure platform for women, but our mission is to get women everywhere outside of their comfort zone and into some really awesome adventures. Basically, we want women to decide and to find within them the bold that is there. That often gets buried by so much other stuff in life. That boldness is still there, and you have to practice finding that boldness, and that's what we're here for.
I started Bold Betties in 2014 because I wanted to make it easier for everyday women to have experiences that would take them outside their comfort zones and help them build confidence. And the reason I wanted to do that was I had moved to Colorado myself about a year prior, and before I came here, I was working for about 4.5 years, 80 to 100 hours a week, and just needed to kind of get my priorities straight, get my head on, and stop living my life inside four walls. So I came to Colorado, spent all this time outdoors, and was just putting myself in these situations that were super scary, really intimidating, things I had never done before and didn't think I was capable of doing. Yeah, I built a lot of confidence and courage through that, and so I wanted to figure out a way to just make it easier for other women to get that, because for me to get that, I took 7 months off work, I spent $5,000 at REI, I was really privileged, and most people don't have that opportunity or luxury. So, I knew that that was the problem I wanted to solve, was making this stuff less intimidating and more accessible. I had to figure out what the solution to that problem was going to look like. We're in 42 cities now around North America, and it's very hyper-local, because that's part of solving the problem is we bring adventure to you. We don't make you come to it.
So it's
free hikes, it's bike rides, it's brewery tours, it's happy hours, it's coffee dates. It can be really anything that empowers women and gets women together locally. About 80% of our events in each chapter are going to be free or extremely low cost. Then we also do regional things. So it might be like a camping weekend up in the mountains here. It can also be national. So we do backpacking trips to Havasupai. Then we also do international. So you can really engage in any way that suits you. We want to meet women where they are.
We are open to complete novices. We are kind of like the gateway to adventure in the outdoors for women. It's not about competition, skill, strength, speed, any of that. You know, we don't care if you're the first one to the summit. We don't care if you're the best rock climber. It's more about getting outside and connecting with yourself and with nature and with other women.
Bravery means being afraid but doing it anyway. It doesn't mean the absence of fear. You're afraid, but you're going to push through that fear and you're going to do it anyway. That can be really hard when you're on your own if you're out of practice. But when you're with a group of women who are all committed to the same idea, they push you through that fear.
The reason we don't step outside of our comfort zone more often is we're scared. But anytime you do something that you're scared of and you don't think you can do it, you prove yourself wrong. And that's super empowering. You know, when you can look back and 3 days ago you were too afraid to go hike that mountain and then today you just did it, you feel like a badass. That's awesome.
It's a scary world we live in. It really is for a lot of people. And sometimes that fear is real. You know, a car almost hits you on the way to work. Sometimes it's perceived. Sometimes you're sitting on your couch and you don't want to answer this email that just came in because it makes you feel afraid. How do you handle that kind of fear? I like to say that having an I did it moment is the best way to get through those kind of fears. Let's say you take a week vacation and you come out with Bold Betties. And let's say you're going to go on, we're doing this really cool canoe paddle trip up on the upper Missouri River in Montana. You've got real obstacles that you've got to handle. You may have to portage your boat around something. You're going to have to build camp. You're going to have to do some pretty basic things just to stay alive out there. Or you could go on a vacation to Mexico on the beach where people bring you daiquiris all day and you read a book. And that's a great thing too. But I like to think about that feeling when you get back and that first email comes through that next morning, probably like 50 emails come through. And you're like, oh, I don't want to do this. I could be on a beach having a daiquiri right now. What feels more daunting? That portage, you had to portage your boat around a waterfall, or those 50 emails? If I can handle that portage, I can handle anything. If I can handle that rock wall, if I can handle that rapid, I can handle those emails, no problem. And that I did it moment is everything, and that's something we don't get to experience a lot just by nature. You have to search out for that, and we like to make that search easier. Be kind, be respectful, be safe, be positive, and be inclusive.
If you go on a trip with Bold Betties, you know that all of the other women that are on the trip with you are going to be Bold Betties. And because of our brand and because of our code of conduct, the women that self-select into Bold Betties, you know, all tend to be very like-minded. And so there's just a comfort level in knowing that they're going to be able to bond and enjoy the experience with the other women that they're there. They don't have to worry about who's going to be on the trip with them and how that will affect the experience. And they also can trust that Bold Betties has curated that experience custom for them and vetted the guides and tour operators that we work with to make sure that the experience we provide is going to be tailored to the Bold Betties audience. We've been shown that it's not for us. We've been shown by the industry that the outdoors is for men, or for the hardcore, the ripped, the extreme, the strong, you know, the people that are going to be doing these really crazy, daring things. And if that's not how you look, or if that's not how you're going to consume it, then it's not for you. You know, if you can't see it, you can't be it, right? And Bold Betty says, screw that noise. You know, there's a different way to consume the outdoors. There's a different way to be outside that doesn't have to be the way you've told us. And you know what? We've shown that there are a lot of women that want to do that and participate that way too. So it's just a great vehicle for us to say, here's an opportunity to do something that's healthy and healing for you and get to bond with women in a way you don't normally, but also tackle something that's intimidating and scary and that you didn't think you were capable of.
For many, stepping into the outdoors can be scary and even intimidating. But Bold Betties is perfect for any woman that is seeking to surround herself with other women who uplift one another and share a genuine love for the outdoors without fear of competition. Many thanks to producer Emily Swank and Fanny Pack Films. On the next episode, we talk about the 3 phases of a startup. If you've got the next great idea, you won't want to miss it. We'll look at how to get off the ground, some great ideas on funding, and growth potential.